Hello, everybody. My name is Massimo Nicolò. I am the lead of the Retina Medical Center in Genova, Italy, at the University Eye Clinic within the Ospedale Policlinico San Martino. Today, I would like to share with you 5 clinical cases on central serous chorioretinopathy. So let's show the first case. The first case is a male patient who was referred to our center because he had a decrease in visual acuity, which was 20/25, and as a matter of fact, OCT showed some fluid under the neuroepithelium, and if you take a look and if you pay attention to the magnification of the OCT, you can see also a very small RPE detachment underneath the fluid, the detachment of the neuroepithelium. This patient didn't mention any other episode of decreased visual acuity, so it was the first episode. There was no history of steroids, and it looks that RPE was not compensated. So we decided to perform the fluorescein angiography, and we found just one leaking point that it was showed in the early, intermediate, and late phase of the fluorescein angiography. It was not very strong. It was not a very strong leaking point, but it was strong enough to be the origin of the fluid pooling under the neuroepithelium. So what was our decision? Our decision was not to wait and see and to wait the spontaneous resolution of the fluid, but to accelerate the resolution of the fluid. So we decided to treat this leaking point with a focal retinal photocoagulation. We performed also fluorescein indocyanine green angiography, but as you can see, there is no significant choroidal hyperpermeability areas. So we decided to treat this patient with a focal laser using a 577 nanometer yellow laser directed on the leaking point. We don't need to coagulate the leaking point. We just need to cause some very light spots, laser spots on the leaking point. And as you can see, 1 month after the photocoagulation, there was a complete resolution of the fluid. Visual acuity was now 20/20. The patient was happy. The arrow, however, pointed the spot laser that caused anyway a very small but not symptomatic alteration at the level of the outer nuclear layer. This is the last follow-up visit on January 2020. Again, there was a complete resolution, a persistent complete resolution of the subretinal fluid. Although there were some RPE alteration that was obvious due to the disease. Second case. This is a male patient with a history of ankylosing spondylitis, and for this reason he was under steroid treatment. He was referred to us because a decrease in visual acuity on September 2013. Visual acuity was 8/10. There was a detachment of the neuroepithelium involving the macular region, and fluorescein angiography showed again a leaking point, a single and extrafoveal leaking point due to the RPE defect, which allowed fluid to pass through the RPE detachment and pulling and detaching the neuroepithelium. Indocyanine green angiography showed a very small area, which is this one that I pointed for you, of increased permeability of the choroid, which is reasonable because this patient is on steroid treatment. Of course, we cannot ask him to stop steroid treatment because otherwise ankylosing spondylitis will recur. So we decided to treat the patient. We didn't wait for the spontaneous resolution. We decided to treat the patient, and we use again, in this case, focal light laser photocoagulation. And this is the follow-up visit 1 month, 2 months, and 4 years after photocoagulation of the leaking point. Visual acuity increased to 1010, and there was a complete and persistent resolution of the subretinal fluid. However, after 5 years, there was a recurrence. There was again fluid under the macula, and the same point that was photocoagulated 4-5 years later again was the origin of the problem, and again we performed a focal light laser photocoagulation, and again we obtained a complete resolution of the subretinal detachment. Third case. We are following this patient since 2009, when the patient was referred to us for a decrease in visual acuity in his left eye. As you can see, there was a huge subretinal detachment. Autofluorescence showed some alteration and some decompensation of the retinal pigment epithelium. We performed the fluorescein angiography, and as you can see, there was the beginning of a kind of disease of the retinal pigment epithelium, but we found 2 isolated leaking points, this one and this one, that were enough far from the fovea. So also for this patient we decided to perform a photocoagulation of the 2 leaking points, and this is the OCT pre-treatment laser, and this is the OCT 1 month after photocoagulation. Actually, there was just a partial resolution of the fluid. Fluid was still there, but decreased in quantity. 2 months after photocoagulation, the fovea was completely flat. However, there was still some fluid extra foveal. However, after 3 months, there was a recurrence of the subretinal detachment. So the patient came back to us. We performed again fluorescein angiography, but we also performed indocyanine green angiography. Probably we should have performed the indocyanine green angiography earlier, at the beginning of the history of this patient, because indocyanine green angiography, as you can see, showed us multiple areas of hyperpermeability of the choroid. So at this time, our choice was to treat this patient with half-dose photodynamic therapy directed on the areas of hyperpermeability of the choroid guided by the indocyanine green angiography. And 2 months after half-dose PDT, fluid was completely resolved. Our patient was very happy because the visual acuity increased, and it was 20/20, and this patient remained dry with a dry macula for a very long time. This is the visit 8 years after half-dose PDT, and as you can see, macula is dry, is flat, there is no fluid, although there is some RPE defect, just extra fovea located. So let's take a look to the fourth case of our presentation. This is a patient, a male patient, who was referred to us on 2009 because of the presence of subretinal detachment. Autofluorescence showed multiple areas of hypoautofluorescence, showing that there was an RPE disease, an RPE decompensation. We performed the fluorescein angiography and indocyanine green angiography, and fluorescein angiography showed an RPE decompensation, multiple areas of RPE disease, and in one of these there was a very well defined leaking point. However, indocyanine green angiography showed multiple areas of hyperpermeability of the choroid. So this is a case of chronic central serous chorioretinopathy, as well as the case number 3. And as you can see, chronic central serous chorioretinopathy now should be treated with photodynamic therapy. We used to perform half-dose photodynamic therapy, and also at that time in 2009 we performed half-dose PDT directly on the hyperpermeability areas, as was highlighted by the indocyanine green angiography. And this is the case 1 month after half-dose PDT. You can see the complete resolution of the fluid. And this is the follow-up at 7 years after half-dose PDT. So there was a persistent complete resolution of the fluid. There was no damage due to the photodynamic therapy. This is the last case, case number 5. This is a very unusual case because it was a female patient who was referred to us because a decrease in visual acuity 20/80 in her only eye, because the other eye was amblyopic. She has a strong hypermetropia, and she was affected by glomerulonephritis, congestive heart failure, and systemic arterial hypertension. This is the ophthalmoscopic and OCT pictures, and as you can see, there was a very huge subretinal detachment involving the macular region and the posterior pole, and choroidal folds are very evident due to the hypermetropic refractive error. So we performed the fluorescein angiography and indocyanine green angiography, and take a look to the multiple leaking points that are evident at the fluorescein angiography. 1, 2, 3, at least 4 leaking points. And take a look to the indocyanine green angiography, how many areas of hyperpermeability of the choroid are evident and are present at the indocyanine green angiography. So which kind of treatment should be performed on this case? So we decided to, first of all, try to treat the leaking points. And for this reason, we performed a focal laser with a very light treatment on these three leaking points, 1, 2, and 3. And 1 month after photocoagulation, light photocoagulation, we observed a partial resolution, not complete resolution of the fluid under the macula. And for this reason, we add half-dose photodynamic therapy directed on the areas of hyperpermeability of the choroid. And after 2 months, 2 months after half-dose PDT, there was a complete resolution of the subretinal fluid. And the resolution of subretinal fluid was well maintained also after 5 months, although there was a very small subretinal detachment by fluid, very eccentric to the macula, very far from the macula. And this is the rate of visual acuity: 57 letters before treatment, 73 letters after photocoagulation, and 79 letters after PDT. However, we know that photodynamic therapy does not work in all cases of CSC. We know that in more advanced cases of chronic CSC, in which there is also a posterior cystoid retinal degeneration, photodynamic therapy is not so effective. This is a case that we frequently show it to our colleagues. There is a huge decompensation of the retinal pigment epithelium, and OCT showed as a posterior cystoid retinal degeneration due to the fact that the fluid infiltrate from the choroid directly the retinal tissue, due to the fact that there is an RPE which is very thin and thick. We performed the photodynamic therapy, and after 1 month we observed the complete resolution of the fluid. But take a look to the 10-month follow-up visit. There was again a recurrence of the fluid. So pay attention to this case and try to avoid to arrive to this case. For this reason, my take-home message is: don't wait too much to treat CSC. Focal laser treatment or half-dose or half-fluence photodynamic therapy are safe and effective. So thank you very much for your attention.